Today, we have one objective: to find some moles. After a long day of searching, I think we finally found them. And of course, exactly as expected, they're hard at work being construction workers? Okay, I guess they are the masters at tunneling, but we digress. We were on the lookout for moles because they're our symbol for molar pregnancy, which is a non-invasive trophoblastic proliferation. In layman's terms, it means that there's a major overgrowth of the type of cell that makes up the majority of placental tissue. Risk factors for molar pregnancies include a history of molar pregnancy, symbolized by this History of Moles book in this mole den, and extremes of age, symbolized by this very old and very young mole in this family portrait. In terms of types of molar pregnancies, there are two types: complete and incomplete. We'll go over complete moles first, symbolized by this mole who has completed their tunnel. Complete moles occur when two sperm fertilize an empty egg. As you'll see, this mole with the completed tunnel is holding two sperm-shaped spoons and has finished their breakfast, so their plate is empty. The karyotype of complete moles is either 46XX or 46XY, accounting for two sets of paternal DNA. The typical clinical presentation for a complete molar pregnancy is vaginal bleeding with a positive pregnancy test, but no visible embryo on ultrasound. We've symbolized vaginal bleeding, or spotting, with the drips of rusty water coming out of these pipes. These patients may have also noted passing vesicle-like clusters vaginally. These are sometimes described as grape-like vesicles and are represented with this lunchbox full of grapes. On physical exam, their uterus will measure size larger than dates. You may remember our recurring symbol for this physical exam finding, which is a save the date card, with the save being much larger than date. Quantitative beta-HCG levels are notably extremely high with complete molar pregnancies. Levels are often greater than 100,000. This makes sense because moles are essentially a ton of placental tissue, which makes beta-HCG. More placenta, more HCG. Our pile of beta glasses should remind you of this extremely high beta-HCG level. You may also remember that beta-HCG can cause some pretty intense symptoms, especially at these high levels. Patients with complete moles may present with consequences of mega-elevated beta-HCG, such as hyperemesis gravidarum, hyperthyroidism, hypertension, and theca lutein cysts. Now let's move on to imaging. The classic description of an ultrasound of a complete mole is the snowstorm pattern, which is a result of all the hydropic vesicles that are occupying the uterus. Our construction mole's ultrasound bullhorn and dusting of snow on the worksite are there to remind you of this classic finding. And finally, treatment for a complete mole is a dilation and curettage, symbolized with this scalpel, and serial beta-HCG levels until they trend to zero, symbolized with the sign reminding the construction moles to leave no beta glasses at the site. In addition to complete molar pregnancies, we also have incomplete molar pregnancies. We'll symbolize everything that has to do with incomplete moles here in the second incomplete tunnel. See how it doesn't reach the bottom? An incomplete molar pregnancy happens when a normal egg is fertilized by two sperm, which is why this construction mole still has an egg on their plate that they're about to dig into with two sperm spoons. Looks like it's one of those breakfast on the job days. The karyotype for these types of pregnancies are either 69XXX or 69XXY. Unlike complete moles, with incomplete moles, fetal parts may present on ultrasound, and in some cases, a heartbeat can be heard. We've drawn in a baby doll in the incomplete tunnel to remind you of this distinguishing finding. These pregnancies self-abort early on, and these patients often present with the signs and symptoms of an early pregnancy loss, such as vaginal bleeding, symbolized with this rusty liquid dripping from the pipes, and cramping. Unlike the sky-high beta-HCG levels of complete moles, these pregnancies have normal HCG levels, which is why there's only one pair of beta glasses at this construction site. The treatment for partial moles is the same for as complete moles, dilation and curettage, and serial beta HCGs. In the final part of the video, we're going to transition from talking about benign diseases to malignant diseases. These are called gestational trophoblastic neoplasias, as opposed to gestational trophoblastic diseases, and are symbolized with this tunnel with an invasive root system growing within it, and a crab fossil. There are a few types of gestational trophoblastic neoplasias, and we'll go over them in a bit. But first, it's important to know that all GTNs are more likely after a complete molar pregnancy. Okay, now let's talk about our first type of GTN, an invasive mole. An invasive mole is a molar pregnancy that has gone on to become malignant. We'll symbolize it with this star-nosed mole digging into, or invading, this third tunnel system. Suspect an invasive molar pregnancy if a patient's beta HCGs don't trend to zero, and instead plateau or rise after a full DNC of their molar pregnancy. Treatment for an invasive mole is chemotherapy, to which luckily it's super sensitive. We've put in our recurring chemistry set to represent chemotherapy. Beta HCG levels should also continue to be monitored and trended to zero. Another type of GTN is a malignant choriocarcinoma, which can follow any type of pregnancy. We'll symbolize choriocarcinoma in this sketch with this mole tunneling into muscle-patterned rocks to remind you that these neoplasms invade into the myometrium. These malignancies are very aggressive and metastasize quickly. Suspect choriocarcinoma if a postpartum patient has abnormal bleeding greater than 6 weeks postpartum, symbolized by this sign that's letting the construction crew know that the pipes have been leaking for more than 6 weeks. Usually, this disease presents with symptoms from its metastases, especially those to the lungs, symbolized by this lung vest, which are the most common site of metastasis. Symptoms to look out for include cough, dyspnea, and hemoptysis, symbolized by the dirt on the lung vest. Other common sites of metastases are the vagina, CNS, and liver. Once you suspect choriocarcinoma, get a baseline chest X-ray, represented with our recurring skull and crossbones flag, to screen for pulmonary mets. Treatment is chemo as well as trending beta HCGs. And that's it for molar pregnancies and gestational trophoblastic neoplasias. Now all we have to do is find our way out of this maze of tunnels and, does anybody have a flashlight?